Back, and after the small video clip, we'll be focusing for today's discussion. We invited Dr. ChannelEye Rupavahini, consultant ENT surgeon. Thank you very much, madam, for taking part in today's discussion as well. So, with our guest, we're going to speak about snoring. Sometimes it might be a sleeping disturbance, might not be for yourself, but for the others. Sometimes will be any big issue when it comes to certain concerns. So, madam, what is snoring?
Snoring is a sound actually. You get from your throat.
Right.
We keep our airway open during daytime. When we are conscious, breathing become little bit of a conscious issue. Or, but we are not purposely breathing. But when it comes to breathing, it happens on its own. But we have some control over our airway when we are awake. But when we are asleep, it becomes totally an involuntary act. So we have to keep our airway open without collapsing by the muscle tone. Now imagine this is the airway, so the muscle tone will keep your airway open. So when we sleep, obviously any one of us, the muscle tone slightly reduced. So if the muscle tone is not there, then there's a negative pressure inside the airway. When there is negative pressure, the tissues are sucked in, and there will be vibration of the pharyngeal muscles. So that causes snoring. So what are the things vibrate? Your palate vibrates, your the uvula, the small part coming from the palate, the uvula vibrates, tonsil area vibrates, the pharynx, all these muscles vibrate. So you get a big sound coming. So it is actually a danger sign. Snoring is not a thing to laugh at, but it is some alarming sign.
Right. So, madam, when it comes to that particular sound, it's like the negative pressure having these muscles being collapsed, and there is a reduced airway, so it starts vibrating. Some people tend to say, now your position matters. So, when you change the position when you sleep, the snoring comes away and comes again. So, what matters with the position?
Actually, when we are sleeping on our back, all the things fall back. So the tonsil, the palate falls back, tongue falls back. So all these can block your airway. But when you're on the side, there is little bit of space to breathe. So as you mentioned, there is a thing called positional therapy also. When we have airway obstruction, after doing all the investigations, some patient we only recommend to sleep on your side. Then their snoring goes away. So that's a simple remedy of snoring also, as you mentioned. When we are sleeping on our back, all the things fall back and our airway can collapse.
Right. So there's a myth, sometimes a general practice practiced by ordinary individuals, that when a person is snoring, when you pull the pillow or just slight change in the position, will move out of the situation. What is the real scenario dealing with that, madam?
So when someone is snoring, we tend to wake them up. No?
Yes.
Sometimes they wake on their own because you get reduced oxygen supply. When your airway is closed, what is going to happen? You are getting oxygen from your inhaled air, because the air should go from the nose to the throat and to your lungs. So if it is blocked here, then no air goes into your lungs, and then you don't get enough oxygen. So oxygen you need to breathe, and it's the vital thing for your life. So then the brain is giving a signal, hey, wake up, you're going to die. Then we wake up in the middle. Again we fall asleep. Again you wake up, because when there is no oxygen, you wake up. So repeatedly this happens during night. Constant awakening and sleeping. Then you become very tired in the morning, because you had a fight in the night, because
struggle to sleep,
struggle to wake up. So you in the morning you feel very tired, and because you have no oxygen, your blood pressure can go up, your heart rate can go up, your brain activity can change. So basically every organ in your body can get affected due to this oxygen business, because when you have less oxygen. So patients are at risk, their life is at risk when there is severe snoring and airway obstruction.
Right. So, madam, you mentioned that this, what you call this position change, and even this negative pressure inside will tend to collapse those muscles and certain things. And at a certain instant, you mentioned that these tonsils come as an alarming sign. Is that the alarming sign? Can it cause these types of dangers to the blood pressure and certain other vital organs, or is it any other significance from an underlying any other cause? What is the matter of alarming there?
Actually, I did not get your question.
Yes.
Now, a patient has lot of problems.
Yes.
That is causing snoring.
Yes.
So we have to find out why
Yes.
patient has snoring. So when we examine the patient, we can when we examine the patient, we pass a camera down the nose. Then we can find out whether the patient has enlarged tonsils, enlarged tongue, nasal polyps from nose to middle of the throat. Because you get vocal cords at the center of your throat.
Yes.
So all the snoring happen before the vocal cords. So from this level upwards snoring happen. Below
Right.
that you get asthma or stridor, you get noisy breathing and you get wheezing. Below this level you don't have snoring. So above this level you get all the symptoms and
Right.
signs of snoring. So if the patient comes is snoring, then we have to examine the patient nose with a camera and the mouth with a camera. Then you can find out the underlying cause for the snoring. Blood problems like thyroid hormone level. If the thyroid hormone level is low, then you are very drowsy, you are sleepy, then patients can snore. So when patient has snoring, we do the thyroid hormone levels also. And then we do the full blood count, because when we are continuously snoring and the lack of oxygen will increase your hemoglobin. The mountaineers, you know, the
Yes.
people who live in people who live in Tibet, higher levels of
Elevations, yes.
elevation, they have high hemoglobin to survive in low oxygen situation. So same thing happens to patients with snoring also, because they have low oxygen, so their hemoglobin is high. And they fall asleep during daytime, so they can meet with accidents while they are driving, and their school performance go down, their job performance go down. So that means the patient is snoring, the whole life is affected, and the society is also affected.
So that's what we wanted to emphasize, it a sense of alarming. Underlying causes is cause snoring, and snoring causes some of the impacts to the vital organs and even to the society. There are some impacts. So to both the sides, yes, it's alarming. So in that condition, madam, for snoring, aren't there any other practical measures that we can adopt to stay without snoring? Is it like only the positioning thing properly, or are there any other things?
Yes, now when we are obese also, when we are obese, we tend to deposit fat in all the organs I mentioned. There will be fat deposit in the tonsil, tongue, neck muscles, everywhere. The collar size also becoming, your
Yes.
tummy become bigger. So then you will have obesity. When the patient is very obese, most of the obese people snore.
Yes.
So as you mentioned, we can lose weight. If our BMI, the body mass index is high, you should be you should have the height and weight balance, because there's a thing called container and contents. Container
Yes.
is your skeletal architecture. Contents are what you have in your, like tonsil, palate, everything is content. The fat also content.
Yes.
So the container, now the container is big, you can put lot of things without getting snoring.
Yes.
So that's why some people who are very tall, although they are fat, you don't feel they are fat, because their container is so big. So the lot of contents can be filled before they get the symptoms. So one thing is your body weight, the body mass index, and the chin position. If your chin is very receding like that, the chin is like this. Now some people have a very short chin, then the tongue will fall back. So then the receding chin matters. And then teeth, the architecture of the teeth. So sometimes the mouth is so small, so you will have obstruction. And then I told you about the adenoid. Adenoid is the swelling behind the nose. So adenoid also can cause snoring. In small children, the main cause for snoring is enlarged tonsils and adenoids. But as we discussed, they are obsolete in adults. But small children, when they snore, we usually find that they have a large tonsil and adenoid.
Right. So there are certain conditions that we can adopt. If you are obese, you can just reduce your body weight, adhering to a proper BMI, because certain fat deposits might be there in certain organs that it will tend to reduce the pathway to air. Certain other things, as doctor specifically mentioned, there are things that we can adopt. Madam, are there any treatments, in the sense taking medications, because some people try to say, oh, you are snoring, can't you like get some medicines prescribed from a physician, to whom that we should refer to, and are there any treatments?
Treatment is now when a patient comes with snoring, we have to find out how severe it is. So how bad the oxygen is. So before treatment we have to do certain investigation. As I mentioned, we have to do a camera test and we have to do a sleep study. Sleep study is, now there is no point in examining a person while they are awake, no? This all happens during sleep.
Yes.
So we have to examine the patient. There are things called sleep labs. Sleep labs are available in the hospitals. So we have to get down the patient around 8 o'clock in the night and connect a lot of leads in the body. Then they sleep and the machine will give a lot of data, information about condition during sleep. And there's a thing called home sleep study also. We can do the same thing at home.
Right.
But it is not as complicated as the hospital one. You have one around your chest, one in the finger, one in the nostril. So like that, few information you are getting from your home sleep study, but that is also adequate because a lot of people are not happy to get admitted overnight.
Yes.
So there are two types of sleep study: home sleep study and hospital one. Hospital one is more complete with lot of information, but home sleep study give little few facts. But to treat, rather not having a sleep study,
yes,
it's better to have at least home sleep study. But if patient can afford and have time, we always recommend to have a hospital sleep study. But many hospitals don't have sleep labs. So that is why we are going for home sleep study. So when a patient comes, we have to do the full blood count to check the hemoglobin, thyroid function test to see whether patient is hypothyroid, and then we have to do the camera test to see what is happening inside the nose, awake. And we can do the sleep study, camera test while patient is asleep also. That is called sleep endoscopy. When a patient, we give a sleeping dose of medication to patient and we pass the camera and examine the patient. So then we know what is happening during sleep also. So we have to examine the patient awake as well as sleep. So sleep study and sleep endoscopy. So all these things will give a lot of information. So we have to analyze them and find out, do we have to treat this patient. As I mentioned, some certain patient on the sleep position change will help. Certain patients, you have to give a machine. It is called a CPAP. Why now the patient, what is happening, we initially discussed, there is collapse of the airway. So the airway is closed like this. So to keep something open, you can give compressed air. So when you give compressed air, this collapsed airway will open like this. So then we can give a CPAP. CPAP is a machine connected to the person with a small mask, and there's a box siding. So the machine will pump air into your lungs. So, but unfortunately, you have to wear this throughout the night. When you are sleeping 7 hours, you have to use the machine 7 hours. But this machine will protect your life. Because when you use the CPAP, the machine will send compressed air to your lungs, then your oxygen supply will be better, then you don't fall asleep during daytime, and morning you feel refreshed, you are happy, and your partner. We did not discuss about the marital problem. When someone is snoring and sharing the bed, there will be marital issues also. They will go for divorce and the other people cannot sleep, lot of fights. So when the spouse or the children can sleep well without disturbing the others. So CPAP has lot of benefits, continuous positive airway pressure.
Right. So madam, you mentioned about the sleep labs at hospitals and certain things that we can exercise at home. So how this home thing can be implemented? Do we need to buy this machinery?
No, there are actually it is done as a private thing. There is a company, when the doctors order the home sleep study, they take the stuff to their person's home, and the charges also less than the hospital sleep study. So they advise the person how to connect the sleep study things into their body. So one of the home people can do it. In the morning, you can remove them and the computer will have all the data. And then they will give a report. The doctor can analyze the report and recommend the machine. Sometimes surgery also works. If the patient has large tonsils, large adenoids, and then the long uvula, large tongue, there are certain indications for surgery, but not everyone is benefiting from surgery. So if the ENT surgeon find out there are indication for surgery, we always recommend surgery. But if there is a indication for surgery, there is no point in giving a machine. Because machine cannot pump air through very large tonsil. Because the machine will also find it difficult to pump air. So if the patient had something to be removed surgically, we have to do that also.
Otherwise, to maintain the oxygen demand and the other consequences, we can just move ahead with this small machinery that will help the others as well and themselves even to cope up with the situation. So madam, with this sleep, is it like the same sleep apnea, sleeping disorder? Are they similar things in
sleep
context?
apnea and snoring is the mildest thing can happen. The very mild thing is snoring. But as the disease progresses, you will stop breathing. Then it's called apnea. Apnea, the word apnea means cessation of breathing. You don't breathe at all. So sometimes the family members also get alarmed. This person is not breathing for about 10 seconds. Then it's serious. So then they try to shake them and wake them up. So apneic condition will actually will make the family members also scared. So sleep apnea is the other end of the problem. Snoring is only the sound, but as the disease progresses, it's a continuum of disease. The final thing is severe obstructive sleep apnea. Apnea means no breathing at all. So you will die now if they have no breathing at all, but you wake up, you go back to sleep. You wake up, you go back to sleep. So continuously this is happening. So then you don't get enough oxygen, enough sleep, you feel tired, and your heart, brain, every organ in the body is affected. So final thing is you can even die in your bed.
Right.
That is like we say, no, the person is very fortunate, he died in his sleep.
Yes.
So this may be sleep apnea.
Sleep apnea, right. Okay, so there are certain conditions that without our knowledge even certain things happen, but it might be a certain disease condition that might be very easily cured. So madam, when it comes to sleep apnea, it's the versus side than the other end as you mentioned, and when it comes to the snoring, letting the snoring condition untreated, if he is not followingly checking the particular reports that you have already mentioned and checking whether there is any other issue with certain sort of a gland or any other weight issue or whatever it is, letting all those things untreated will eventually gradually make the condition worsen to sleep apnea, is it?
Yeah, actually all these symptoms you mentioned is sleep apnea. So sleep apnea is a diagnosis where we know the patient is stop breathing. The sleep study reports give all the information, how many minutes they have stopped breathing, how much oxygen they are getting, whether patient is struggling in the bed, whether they move their arms and legs, and what happened to the eye, whether the eyeball moves, how the heart works. The proper sleep study give all the information. So patient not having proper treatment for sleep apnea will end up with organ failure. So that is called metabolic syndrome. Metabolic syndrome means you end up with diabetes, you end up with stroke, you can end up with heart attack because of the lack of oxygen, and then you can have pulmonary hypertension, your lungs can get affected. So all these conditions, and your liver also, because it's a metabolic syndrome. So your liver can get, your pancreas can get affected. So other than your 4 limbs or the rest of the body can get affected. It's
just the only physical structure remaining, but the function, everything collapsed down. Madam, as you like specifically mentioned, those types of conditions, people are very scared about those words actually, in the sense of like certain heart diseases and other things. So can you just explain once more to our audience, how does this affect and gradually make it this condition worsen?
Yes, now as I mentioned, this will not only affect the person and the family, the society also, by having the increased risk of road traffic accident, and the productivity of the person also goes down. When
Yes.
someone is sleepy, they don't work properly, so the workplace productivity goes down, school performance goes down. So the society is also, if you are not a productive person, the whole society is affected.
Yes.
The oxygen supply, when the oxygen supply is not there, the blood vessels contract like this. The blood flow is flowing in the vessel like this. Without the oxygen, the muscle undergoes spasm and the blood vessels become contracted. Then you can get heart attack. And same thing can happen in your brain also. The lack of oxygen make your blood vessels to undergo spasm. So that can affect your brain vessels. Then you end up with stroke, affect your heart, you can end up with heart attack. But nothing will happen if you get the proper examination treatment. All these can be prevented. Even some people get hypertension, because when the blood vessels, free flowing blood vessels become smaller like this, the blood pressure will go up. So the hypertension is the reason for diabetes, hypertension, heart attack. So some people young hypertensive, when they come, a young person comes with hypertension, we always exclude this condition.
Right.
Sleep apnea.
So that means when it comes to certain disease diagnosis, even it might be hypertension, it is related to heart disease, it's like separately cardio we have to separate, but when it comes to this type of context, we have to exclude this factor, as madam mentioned, because otherwise, like treating hypertension is not might the real cause, but we have to treat the sleeping disorder, sleep apnea, in that condition. So there are many interconnected matters. It's not like we are giving you these advices to advise doctors and get your own treatment, but to get aware about these things, that there are certain things that you have to know, and in certain cases to facilitate the professional that I'm having this type of a condition. So even like in certain conditions, madam also mentioned, when it comes to these types of conditions, you must tell your doctor you're having these types of allergies likewise. So as we are giving you this understanding, you must be able to facilitate the physician. That is the real intention. It's not self-prescribing everything and doing, yes, this is what I want, just please write and give, because I have no authority to buy medicines or pharmacy, just give me the prescription. No, that's not it. But we have to understand these concepts and the principles with these explanations, and to get this knowledge and to implement it practically, might be for you, might be for your loved ones. Madam, when it comes to those conditions, sleep apnea or sleeping disorder due to the lack of oxygen, might be the contraction of blood vessels, and other consequences, there might be serious heart failures or hypertension conditions, and even you mentioned about the young hypertension condition. There are a lot to consider. So but these sleeping issues, it might not be concerned by the general public. Alright, it's just snoring. Alright, we need like drag the pillow when he wakes up, that's it. So as a consultant ENT surgeon, what can you say about this sleep condition, how important it is?
Actually, if one of your family members are snoring, and then nowadays handphones are there, you can take your camera, take your phone and video. You can, so you can show the doctor. So it is very helpful. A lot of people bring their videos now, and because of the COVID thing, lot of households now they have pulse oximeters. So you can put a pulse oximeter. If the pulse oximeter is working, it's battery operated thing,
Yes.
no? So it's not a complicated thing. You can see the oxygen saturation. So you have to break rest with your loved one. The person is sleeping, you have to sit by the bedside and record the pulse oximetry and see the oxygen saturation and video clip. Then when they stop breathing, the doctor will understand, oh, this is apneic attack, and then we can time how many seconds he take to breathe. So this information can be given by the family members. So family members have lot to do. So if someone is snoring, don't ignore. Take your time. If pulse oximeter is available or video camera is available, you give that information to the doctor and somehow drag that person to the doctor. And ladies also snore. Mainly it is a male disease, but ladies, because they are feeling shy about it, they don't even come to the doctor.
Yes.
So after menopause, before menopause, snoring is less among women, but after menopause, ladies also snore. So it is your duty, the ladies also, the husband has to take the wife.
Yes.
Most of the time actually wife take the husband, but the other way is also possible. So because of the social impact and because they are shy, they don't mention this. So if someone in your family is snoring, please go to a ENT surgeon, mention these things. We have facilities to examine the patient during while the patient is awake as well as while the patient is sleeping. And then the sleep studies also, some hospitals government sector also available, but the home sleep studies also in the vicinity of Colombo they provide it. But when you come to a private hospital or government hospital where the sleep study is available, you can get a date and get it done. But the problem I find it, people don't come to the hospital. After doing several awareness program, now more and more people are coming, but I am sure still there are big amount of big number of people who are not aware of the condition and not been to a doctor. I heard when I went through some YouTube videos for this OSA in America, everyone is having a dental appointment now.
Yes.
The whole population should have a dental appointment. They have trained all their dental doctors to ask few questions from patients.
Right.
And unfortunately in our country we don't have appointment where everyone goes to the doctor. So in most of the developed countries the dental appointment is a must. So when they go to the dental appointment, dental doctor asks the few basic question: do you feel sleepy during daytime? Do you, when you are awake, you are very tired and tired in the morning, and then do you have hypertension, diabetes? Basic questions you can ask. Then by that way, all population is covered. Unfortunately, in our countries, like developing countries, patients, everyone does not go for a doctor's appointment. So sometimes when the family members drag them also, they are very reluctant to go because they say, no, I'm okay. Yes. They are not happy. So my plea from the population, the people who watch this program, if you know a neighbor, anyone having snoring, the patient does not hear the snoring, others only hear.
Yeah.
So if the family members hear snoring, please take the person to a ENT surgeon. There are ENT surgeons available all over the country, and then sleep study somehow. Now it is better to get the sleep study done in the private sector, because if you start getting pressure or diabetes, you will be spending tons of money on your medication. So it is better to be on the safe side. Prevention is better than cure always. So here there are a lot of things can be prevented by treating sleep apnea. So that is why it is very important.
Right. When having this discussion, people might understand that there are many things that we can identify with proper sleep, and without that proper sleep there are certain conditions that will be developed. And you might think that if you are young and if you are suffering from hypertension, it's time for you to check whether you have proper sleep. And madam, you mentioned when it comes to this discussion, it is encountered by the other people, sometimes the bed partner. And when this discussion moves on, we came to discuss about certain facts. People, they don't have adequate sleep. They tend to wake up because due to the lack of oxygen, and in the morning they feel any tiredness or like some not fresh, and they can't involve with their studies, work or whatsoever that they are engaging with in a fresh day. So it's like the bed partner should identify what he or she undergoes while sleeping. But when it comes to the other side, madam, like if a person has some adequate sleep, he's having well adequate sleep, but he is snoring, that can be identified by the bed partner. And even the snoring sound probably he might not be able to hear, and in that cases, not having adequate sleep, like waking constantly up like within short durations of time, and the preceding day is not that much full of energy, can he himself walk to an ENT surgeon that I have this sleeping disorder?
Yeah, but very unlikely they come. I have not come across people like him.
Right.
So they don't come and say, I don't feel okay in the morning. I think because if they don't hear the noise, they are not bothered.
Yes.
And then when tiredness, they do not analyze it as lack of oxygen. So people are not that much aware of these things, no?
Yes.
So self-referral is very rare. Mainly the family members, neighbors, sometimes neighbors send, because Colombo houses are adjacent. Sometimes neighbors bring the patient. We can't sleep from the other house. So it's mainly referral from other people. Self-referrals are very rare. But if we watch a awareness program like this, they might come.
They might
because
come.
then they will realize that I have the problem like this. Because when we do the mass media campaign, there were some self-referrals.
Right. Okay, madam, the other thing that you mentioned, there's a possibility of greater males having this condition. And what is the real scenario? Why the males are more?
The estrogen protects women from many problems. So, you know, the heart attacks, pressure, diabetes, everything is less common among premenopausal women. So, after menopause, men and women become equal. Then the estrogen protection is not there. So, males and I forgot to mention, smoking and alcohol is also very bad. When we take alcohol, our muscles relaxes. So we have more snoring. All the wives say when he takes alcohol, he snores more. So, and in our country, you know, most of the males take alcohol. They do smoke, and so smoking alcohol is higher among men in one reason. And obesity also. It's the big tummy and the large collar size, those problems also more higher among men. And then they are most of the time seated. Now your women, they do housework, so more active. Women are more active. Men work, they are working seated, driving. Then three-wheel drivers is one of the commonest problems among three-wheel drivers, because they are always seated doing that. So sometimes when I travel in my car, I lower the window and tell them also, come to our clinic, you must be having sleep apnea. Then they say, ask, how do you know? By looking at you, I know. So they are huge, their tummy is huge, they are very fat now. Three-wheel drivers are getting more and more sleep apnea. So most of the time seated. So that also increase snoring. And then females and males become equal after menopause. So because of the estrogen protection, lack of estrogen protection. So we all can be aware of this and prevent it. But there is a certain population you cannot prevent it, because I told they will become anyway without proper tone when we grow older. We become floppy, you know, our muscles become floppy and flabby. So if anyone will snore at the latter part of their life. So so keeping the muscle tone is your business, because they say muscle has no age. You can do, there are exercises given in the internet how to exercise your tongue muscles, neck muscles, keep your tone. And when you do small weights, that will keep your muscle tone in all the muscles of your body. So muscle tone can be kept in spite of your age. So that is voluntary thing. You can do exercises, and then you can keep your weight at a, you know, you can control your weight. So then that also, and you can stop smoking and alcohol. And sitting also, some jobs you have to do seated. But now in other countries, I must tell Charita, they are removing all the chairs from the offices. They have a higher elevation for the computer and ask them to work standing, because when they say sitting is worse than smoking. So if you sit 8 hours per day like a couch potato, all the risk factors are increased. So now they are they tend to have not to have chairs in the offices. Then your longevity, your life will last longer if you don't sit in a chair. So imagine, we are not born to sit in a chair. No, we were constantly moving before the agriculture. No, we were moving from place. We were nomads. So then I think no one had sleep apnea when we were nomads. So this lifestyle, this obstructive sleep apnea is a modern day disease because of our lifestyle. So lifestyle change is easier said than done. Although I say like this, now can you imagine an office without any chair?
Yes.
The people may not opt for that. They will go strike.
Yes, demanding certain rights. Our chair has been lost.
But for the radiologist doctors are the only doctors who are working while seated. No, we don't have a permanent chair. No, any ward doctor or doesn't have a permanent chair because we have someone will sit. No, when we are not there. So. But the radiologists always sit and report on the x-rays. Now in the UK, the radiology department, they have removed all the chairs. They are having the illuminators at a higher level. They have to report while they are standing.
To reduce this risk of certain diseases, right? Okay, we had a comprehensive discussion about sleep apnea, sleeping disorder. That is a topic that we must discuss, but it is not discussed commonly. So these are things that general public all should be aware. There are certain conditions that might be the sleep the main cause for that, so better focus on those things. So thank you very much, madam. Dr. ChannelEye Rupavahini, consultant ENT surgeon, for doing the honors with us. The sleep apnea, one of the most important areas. When you listen to the discussion, you might be very clear about what we have discussed. Yes, madam.
I just want to mention children are also not spared. They also have, due to the increased obesity among children and the enlarged adenoids and tonsils, they are also at risk. So remember, parents have to bring them if they are snoring.
Right, okay. So that final comment, we are going to wind up today's program. Once again, thank you very much, madam.